Okay, so today I want to cover directional terms, and I think this is really vitally important for anatomy and physiology because we use these terms to describe a number of different things. We use it in radiology, some of this terminology. We use it in dissection. We use it in surgeries. And then, of course, we use it to name things when we're talking about certain structures in the body. So let's go through some directional terms, all right? When we talk about superior, we're talking about towards the head. When we're talking about inferior, we're talking about towards the feet, okay? When we're talking about lateral and medial, lateral is further away from the midline, and medial is towards the midline. So lateral is away from the midline, medial is toward the midline. Okay, those are very important. And then when we look from front to back, anterior is front, and posterior is back. Okay? So those are some really important directional terms. We also have some others. When we say the term ipsilateral, ipsilateral means same side. Contralateral means opposite side. So those are important terms as well. We have terms to describe the position of the body. If you are lying face down, you are prone. You can remember it as prone on the pubic bone. When you are lying on your back, you are supine. You can remember it as supine on the spine. And so those are some other directional terms that are important. Another one that people get very confused on that has to do with limbs is distal and proximal. Proximal is closer to the core or trunk, and distal is further away. So a lot of times these terms are comparative, right? I can say that this is the distal end of my humerus, which is the bone in the arm here. This is the proximal end, right? So closer to proximal, further away from distal. Okay, those terms are important. Some other easier ones are things like deep is deeper and superficial is closer to the surface, but those are important to know as well. And then we have plane lines that are also going to serve and be important as well. When we look at plane lines, we have a sagittal plane line, and so mid-sagittal is going to go right in the center, and it's going to separate the left from the right. That's going to be your sagittal plane, okay? A sagittal plane line is any of these planes that cuts in this direction. So if it's in the center, it's called mid-sagittal. If it's anywhere outside the center, it's just sagittal. Mid-sagittal is sagittal, but it's right in the middle, okay? If we look to dissect this way, okay, the plane line, where we separate anterior from posterior, that's called a frontal or a coronal plane line, okay? If we were to cut this direction, where we separate the superior from the inferior, then we're talking about, there's a couple of names for this, a transverse plane line or a cross section. It is sometimes called horizontal. The only reason I don't like horizontal is because if you're laying on your back, now it's a vertical line making that horizontal plane line because it's in reference to the body. So transverse plane or cross section is what would separate the superior from the inferior. And then, of course, there's a diagonal plane line, which is called an oblique plane line. Okay, so and that would go on an oblique angle or a diagonal angle. And so those are your plane lines. If you have any questions, let me know. Stay strong. I'll see you next time.